Adults aren't getting it right when talking to their kids about death, but here's how to do it better. I can tell you as a hospice nurse, there are families that seem to have gotten it right when talking with their kids and allowing their kids to be around, and families that haven't. The ones that whispered about grandma and grandpa dying or didn't let the kids come in the room when grandma and grandpa were dying, I feel really missed out on a good teaching moment. Whereas there are some families who had already spoken to their kids about what to expect, what they're going to see, how to talk to, their aunt or uncle who's dying, and prepared them for what to expect when going to see their loved one who is dying. From a hospice nurse perspective, the more they can be involved, the more they understand, the better things usually go. Times have changed, and death is no longer happening in the home like it was in the 1800s. So it's becoming this more and more taboo thing. In the 1800s, many children were dying, right? So a lot of children were losing their siblings. Back in the day, death was happening a lot more often, and it wasn't a medical emergency. People were sent back to their homes. Grandpa died at home with the parents and the kids and the grandkids, everyone there. The wake was in the home. A lot of siblings had other siblings die. So death wasn't this tucked away, hid away thing like it is today. And because of that, we need to relearn how to bring this back into our lives and how to talk to kids, because there's nothing worse than not talking to them. And don't get me wrong, I think most people want to talk to their kids about death, but they just don't know how. So in this video, I'm definitely going to discuss with you different age groups, how to talk to them, what to say, what not to say. The biggest thing to me is preparing the children. I love the word preparing. All my videos I talk about prepare. This is the same thing with children of any age, 2 years old, 6 years old, 15 years old, right? You want to prepare them in an age appropriate way, which I will get into, about what they're going to see, what is going on. Grandpa is sick and we think he's dying. What does that mean? What is he going to look like? If you're afraid, you can say so. If you're sad, you can say so. Keeping an open dialogue about the experience. And of course, you're going to talk about it in age appropriate ways. So for instance, a child ages 2 to 6, right? They are thinking in very literal terms. So that's how you're going to speak to them. You're going to speak to them very literally. But you also want to keep it simple and very clear, right? So here's an example. When someone dies, they don't breathe, they don't talk anymore, they don't eat anymore, but they're not suffering. They don't have any pain. Their body has stopped working. And of course, if you say stuff like this, children are going to have questions, and you just try to answer them as simply and as clearly as possible. If they say, is my body going to stop working? Am I going to die? You can be truthful, yes, but most people live a long time. And a lot of times children at that age will also repeat the same question over and over and over again. You can answer the question over and over again. Give them time if they have more questions. You can have them draw a picture of the loved one dying to give to them as a gift when you go visit, things like that. Now, children from ages 7 to 12, they are starting to grasp the idea of death, the finality of it. So they may ask deeper questions and maybe fear a bit more. It's important to use words like death, dying, dead. So yes, they are dying. No, they're not coming back. And then I would always say things like, it's okay if you feel sad. I feel sad too. Or it's okay if you feel scared. I feel scared sometimes too. The unknown is scary. I think 7 to 12, it can be a lot different. So, a 12-year-old might be able to grasp that a little more versus a 7-year-old. So you have to, know your child and who you're dealing with. But generally speaking, again, keep it clear and keep it concrete. I want to take a moment to talk about something that's really important, especially for women in their 40s, 50s, and beyond. Many of us hit midlife and suddenly our bodies just feel different. Whether it's changes in weight, sleep, skin, or mood, it's easy to feel like something is wrong, and it's even harder to find someone who really listens. As many of you know, I'm in my mid-40s, and once I hit around 42, things just started changing. My headaches and migraines started getting worse. I couldn't sleep. I just felt different. No matter who I told, what doctor I talked to, no one seemed to care or really want to help me. Help my migraines, help me to sleep better, help my mood to be better. I was gaining weight. No one cared and no one seemed to really listen. So I set out on a journey to find someone who would listen to me and who really cares. And that's where today's sponsor, MIDI Health, comes in. MIDI Health is a virtual clinic made by women for women to help us through perimenopause, menopause, and all the challenges that come with it. They're not just another provider. They're a team of clinicians that actually understand what we're going through. And they're trained to treat the whole person and not just the symptom. The relief I felt knowing that something like this exists, that there are clinicians out there that believe me when I say something has changed and that I need help. Someone needs to help me figure out what's going on with my body. And then to hear that I am normal and that there are solutions out there and that there are clinicians that will listen to me and believe me was such a relief. In fact, 94% of MIDI patients report improvements in hot flashes. 93% say their sleep has gotten better. And most women see noticeable results in mood, focus, and even skin in a few months. It's not magic. It's personalized, empathetic, and science-backed care that works. Getting started is easy. All you need to do is book your virtual visit by taking a few minutes to set up your account. Enter your insurance information, tell MIDI about your symptoms, and choose a time to meet your clinician. I love that they accept insurance and there are no surprise fees, just real care from someone who hears you. You'll discuss your symptoms and your health history in depth with a nurse practitioner. They are trained in weight management, perimenopause or menopause, and skin treatment. They get the tests you need, and if blood work or imaging can help, MIDI personalizes your treatment for you, and they'll send you to a convenient local facility that accepts your insurance. It's easy to integrate MIDI into your health routine. You'll get all the virtual follow-ups you need to dial your treatment and take preventative steps. They also partner with your other doctors and refer you for in-person treatment when needed. There's no membership fees or hidden costs. Also, MIDI bills to your insurance, just like any other healthcare provider. If you'd like to take the next steps like me and join more than 200,000 women who love and trust MIDI, I really encourage you to check them out. Just go to trymidi.com/hospicenursejulie and use my code SAVE15 to get $15 off your first prescription product after your virtual visit. Again, that's trymidi.com/hospicenursejulie. It's time to feel like you again. Now for teenagers, they may understand death cognitively, but they might not be emotionally fully developed to fully express that, right? So it's more about trying to ask open-ended things to get them talking about how they think, how they feel. Just even saying something open-ended like, how are you feeling right now? Do you want to talk about anything? How was that experience seeing grandpa? Letting them elaborate on that. And again, before any of them go to see their loved one who is dying, which by the way, I fully believe they should be involved in the process. Unless they explicitly say to you, I'm afraid I don't want to, of course, you can always talk that through and maybe it is too much for them and that isn't something they need to do. But generally speaking, I would always advise them to be involved, but you have to fully prepare them, what they're going to see, right? They might not look like themselves. They might be breathing differently. They might not wake up when you say hi. All of that is normal. All of that is okay, and they are not suffering. Now, I would say if your loved one who is dying is having a hard day and they are suffering or there's a lot of issues going on, you might not need to involve them in that, right? They don't need to see everything, especially if they're younger. But it's important that they understand what death is, that it's a part of life, and that you're there to support them. Seeing death is not inherently traumatic. Often the trauma comes from the confusion around what is going on or the secrecy. Don't go in that room. Keep them out of here. Then they hear their mother in the room crying and they're confused about what's happening. Now, I see why you're trying to protect your child, but really all of that is causing more confusion. So again, preparation, preparation, preparation. And it's okay if they see you grieve. It's completely appropriate for them to see you crying over something that is really sad. You're also allowed to be grieving while they're there. It's all a part of life. And it's all important that all of us see that it's okay. It's okay to feel all types of emotions around the person who is dying, and to be able to express those freely. And I think as long as we are discussing these things and the children understand that they didn't do anything wrong, it's not their fault, and that you're gonna be okay, it's a beautiful thing to embrace that. I think this also would be helpful with pet loss. One of the first things children lose are their pets. This goes for pets or for humans. I think involving them in the process, helping them understand and explain what's going on, will just overall make the experience better. Still sad, but a little easier on them. So 2 questions that many children often ask and parents don't know what to say. 1, will I die too? Or, are you going to die? Tricky questions, but you say the truth with love and compassion depending on their age. So for example, you could say, everyone dies, but most people live a long time. A lot of children will say, where do people go when they die? Or what happens after they die? Where do they go? I would generally say you answer with the truth depending on age, right? So you could again say something like, oh, there are many different beliefs about where people go when they die. It's one of the greatest mysteries, almost make it exciting. It's one of the greatest mysteries. What do you think? And they might ask, well, what do you think? And you can give a truthful answer as long as it's delivered with compassion, right? And allow them to come up with what maybe they believe. Give them some examples of what people believe. And a lot of times kids will go, well, I like that one. And it's like, okay, great, for now. And if they continue to ask, you can continue to have open conversations about it. So lastly, what do you do after the loved one has died? What are some things you can include your children in to help them feel part of the experience? Number 1 are rituals, right? If they are there at the house when the loved one has died, you can have them in the room with your loved one's dead body. You can have them put maybe flower petals around the body. Again, depending on the age, right? And depending on your family's traditions. But you can involve them in the process, especially if you're preparing them and making it like a beautiful ritual to say goodbye. You can have young children do artwork of the loved one or how they're feeling in the moment when it's all happening, right? So involving artwork. And of course, you can always read books about the end of life, about death, about after a loved one dies or a pet dies. There are so many good resources out there. Check the description for more.